You're listening to the Veterinary Innovation Podcast.
You're listening to the Veterinary Innovation Podcast. My name is Shawn Wilkie, and along with my awesome co-host, we interview the innovators in this space and also our friends. So, Ivan, why don't you go ahead and get us started today?
Hey, I'm Ivan Zach, and I'm very excited we have a repeat guest. I'm always excited to hear the updates from our friends. Today we have Yang Shi. Yang is the co-founder and chief executive officer of VetSnap. Prior to co-founding VetSnap, Yang was head of technology at National Veterinary Associates, which is NBA, and before that worked in a variety of different roles in IC design, aerospace technology, product management, and management consulting. He lives in Southern California with his wife and pup Penny and enjoys traveling, architecture, and sitting in front of paintings at museums. Yang, welcome to the show. Thank you for coming back.
Hey, thank you for having me. Really glad to be here.
So it's been at least 10 months since the last time. So what we're focusing on today, so VetSnap is democratizing controlled substance management in the hospitals, which is a problem in our industry that you're trying to solve. And tell us what is new in the last 10 months. What did you learn while building this in our industry?
I think we learned a lot about how to scale up and serve customers. I think since last time we spoke, it's been 10 months. We had maybe 15 customers signed up using our products 10 months ago. Now we have about 400 plus signed
Very
up.
nice.
Yeah, so that growth rate was quite fascinating. Like even a third person just to witness that. So I'd love to share a little bit about how we did it and where we're failing, where we're succeeding. I think that the key there is we're always failing a little bit, just don't fail a lot. And other stuff I learned was just like in general for our industry, right? Controlled substance management is just not very well understood. It's like the boogeyman. It's everybody knows that they're supposed to do it. You know, on VetSnap, we started providing webinars and blog articles to try to provide more education for this aspect of hospital operations. We just saw there was like a huge demand for it. There was a huge knowledge gap. And nowadays we're looking and piloting into the non-veterinary space. You know, so like you heard it here first.
Oh, wow.
Because if you think about who is the end customer for controlled substance management, right? Like who are our clients? Is it the hospital? You know, is it the practice manager? Or is it the DEA agent that's walking through your door?
That's interesting.
So because of that, you know, like a lot of startups, they tend to lose focus when they branch out into different business lines. But for us, it's been very, very fascinating because once we made that realization that the forcing function isn't our, you know, intermediary customer, which is our hospitals, but what our hospitals are really looking for is a platform to help enable them to serve their end customer, which is the state or federal agent walking through their door. Obviously, I've rambled on a little bit, but a lot of different angles. But, you know, like getting into the human space, I just saw that it's almost like a night and day compared to the veterinary space.
So, Yang, this is very interesting. Can you walk us through the product? Because I haven't seen your product, to be honest. And can you walk us through the experience? Like, what is it like? Because obviously, what I'm picturing is the logbook that you hate because you need to remember all your surgeries at the end of the day, but you need to type in stuff.
Yeah.
Is that now smoother? Is it more palatable as a process? What does it look like if I use VetSnap?
Yeah, for sure. Like first, like we focus a lot on the flow. We want it to be very smart, no pun intended to smart flow. But we really focus on the customer journey, right? So if you think about the customer's journey, what the DEA and what auditors are looking for is a life cycle of a container. And if you think about a logbook, a paper logbook, what hospitals should be doing is from the moment that container of controlled drugs enters your hospital to the moment that it is finally finished up and wasted, or whatever amount is like wasted, you know, to RX destroyer or whatever else that they use, or, you know, a reverse distributor, that entire chain of custody needs to be tracked. So for us, our product, we help manage every single aspect of how that container is manipulated. Who received it? When did they receive it? This is just like standard. It's in a paper logbook, right? But we make it a lot simpler for them. To when it is opened, where does it go inside the hospital? So as a side note, a lot of hospitals may have multiple paper logbooks because you can't share one paper logbook in a very large hospital. For us, it's, like you get a total view of where all your containers are and you can use it, and the balances are tracked, holistically. And then when it's tracked, there's a lot of information that the DEA is looking for that it's very tedious to fill out. You have to get the client info, the patient info, the breed, the client address. All of this stuff takes time to fill out. You have to tag it with whichever doctor's prescribing it, who actually used it. And then when you manipulate it, say you used 15 milliliters of something and you needed to add another 2 milliliters. You're supposed to track why you did it. There should be justifications for all that. So our software makes it a lot easier for people to do that because we're integrated with the practice management system. A lot of that data, double entry, having a smooth flow to everything, right? Like double entry is removed. We get to look into the practice management system in order to pull that information. And then the other part is everybody hates reconciliation. That's like the biggest pain point for every single. It's fascinating, right? Like you think who's actually doing this? It's not your your cheapest resource, your least experienced resource. It's either a junior doctor or it's like one of your most senior technicians that you're trusting with this, right? Yep. So they're sitting down on a Sunday. They're looking at a paper logbook and they're trying to figure out where the mistakes are. So they go to the practice management system and print it out. And they basically do a Where's Waldo repeatedly. Because we're automated in this kind of reconciliation process by being integrated with the practice management system, we do the reconciliation on a nightly basis for them. So it catches a lot of the mistakes, like forgotten logs, incorrect quantities being used. And then finally, right, like when you finish a container, all of that is also tracked. So it's the whole life cycle of the container. That's our product. We make it super automated.
So I'm really still stuck on Ivan's question is like, I understand the concept of the product, but we're on spoken voice. So what are we talking about here? Are we talking about a software that's kind of running behind the practice management software, pulling that data, making those logs kind of in an automated way? Or are we talking about a desktop application that synchronizes to the practice? Like, help us visualize what the heck VetSnap is.
So, if you think about it, the integration with the practice management system helps in certain aspects. But at the end of the day, this is really just a very, very easy to use, intuitive logbook.
So Yang, just more questions, maybe rapid fire. Are we in a web browser? Like, where's this software running? Is it a local install? Like, what is it?
Yeah, no, it's a web app. It's also on your phone. It's also on the tablet. Hospitals take it when they go on mobile calls to farms and stuff like that.
Awesome. So I get the next question. So, and this is a doozy, so okay. I apologize, but we're friends, so I'm able to do this to you.
Yes.
So I was talking to a doctor. Her husband actually works for my company. He's our CFO.
Yeah.
And she told me about 2 clinics she works in. Mm-hmm. One uses EHR, electronic medical record, mm-hmm. similar to the PIMS, mm-hmm. and another one uses paper records. Mm-hmm. And she told me that she sees 20 more patients at the clinic that uses paper records. And so we are all in technology, like it or not. We've chose our path.
Yeah.
And I think technology has really screwed up a lot of things that we do, in veterinary medicine and human medicine and all kinds of other areas. And I can tell you that anybody that's listening to this podcast thinking, hey, the logbook kind of sucks, maybe we should get this VetSnap thing, is also thinking the exact same thing, which is this technology going to do what electronic records did for my hospital, which is slow all the doctors down? Yes, they have great detailed logs that maybe they can read because they're legible. But I find that technology has a way of kind of like, making things worse and not necessarily better. How have you guys focused on the UI and the user experience and the customer journey to make sure that you're not just another piece of software slowing down the doctor in the practice?
So now I know you're my friend because this is actually a softball. What is it called? Like right over the home plate? Like it's a very easy toss. I should have mentioned this from the very beginning. Like our software isn't designed to disrupt the flow. So what we did was like from the very beginning, when we went into the hospital and we saw how they did controlled logging, we mimicked and copied that behavior. We mimicked that flow. So rather than disrupting, and I'll give you an example. The best way to prove this is to tell you how we do training. We train up a hospital within 2 hours. That's all it takes. The person that's responsible for logging, they just need 2 hours of training. We do like 3 sessions with them and it's done. You know why it's so simple? It's because it's intuitive. It follows the current flow. However you think your current flow is for doing control drug logging and your paper logs, that's how we do it. We automate where we can. We simplify where we can. We also guide all your other technicians and doctors who are filling out the logs to do it in a similar fashion so there's consistency. But it doesn't violate how they currently do things. Like, our goal is to kill friction, Shawn. Like, think about, like, what do we do every single day? We're looking for ways to kill friction. Now, I also want to address your point about why paper logs, some people may say, like, paper logs, I was smiling when you said that, may be faster than digital logs. So that doesn't mean you're compliant, okay? Like, a paper log's not going to remind you if you're not compliant. Paper log's not going to remind you if you forgot something. So, like, a lot of people say, is it even going to save me time? It's like, yes, it will save you time. And on top of that, it's going to make you actually be more compliant more easily.
Yang, I have a weird question for you, just because we're working so much on burnout and other stuff. There's a problem in our industry, and I'm kind of wondering how much you see of that. When people burn out, some of them are actually going into dark places, which might be related to substance abuse.
Yeah.
How many of clients that you see are actually coming with the problem rather than preventing the problem with the drug logging? Or do you see a lot of hospitals that say we have a problem, we need to tighten this up? Is this actually like, because you're probably getting those clients. Are there a lot of clinics like that?
Yeah, so if you're talking about kind of just well-being of your employees and addiction, I'm quoting a number that I've heard from some of the experts that we've had on our shows, and I think it's around like 15% or more. I think it was like of nurses in our industry that might have some kind of addiction problem.
15?
Yeah, 1.5.
That's crazy.
I can't cite a source. I always would prefer to cite a source. Let's just say that it's probably high, right? Because like if you think about the availability of controlled drugs in our hospitals, you could have a pill that is worth $1 in your hospital, and I've heard it could be worth, some ridiculous number like 50x on the streets or something like that. And then you have all these like fentanyl issues. I mean, like everything that I'm reading in the news, right, is like showing up in our logbooks when I serve our hospitals and I meet up. I'm like, oh, I recognize that drug. I'm not at liberty to really share because we have like pretty strict confidentiality. You know what I mean? But I will say that people are coming for many reasons. You talk about burnout. One of the reasons is like I've had technicians tell me after I show them how our product can save them. Like our product saves the average person doing control logbooks around 75% of the time. Like we kill 75% of their time. And guess what? It's like the worst part of their day. It's not the most productive part. It's what they hate to do.
Yeah, it's just the most boring thing. It's like reconciling like bookkeeping or something. Like it's just.
Yeah, like Simpsons, the opening scene where Bart's like at the blackboard writing things over and over again.
Yeah.
Right. We had a technician say like when you get a box of vials of a drug, you're supposed to put in every single vial into your logbook. We've had technicians say like they're like almost on the verge of tears because they're about to like head out for the day, but you're supposed to log your drugs right when you receive it. And you get like a huge shipment, and they're there for like then like an hour or two, just like writing the same thing over and over again. We cut that down to like 5 seconds each entry. So, but back to the point about like issues, I think we're starting to see hospitals and also like corporates. Corporates are starting to realize it's a huge deal, right? When you're buying a bunch of EBITDA, a bunch of like profits of a hospital. What are all the long tail risks? And it's not that far off, right, for an agent to come and shut down your hospital or fine you like, $200,000. And, back to the addiction issue, they've kind of like focused so much on the human side that like I wouldn't say solved the problem, but like a lot of human hospitals and operations have tightened up. And then veterinarians now they're seeing as like, it's like a more lower hanging fruit. For lack of a better word, they know that there's issues in a lot of our hospitals and they're going there.
It's fascinating. Have you heard any horror stories of hospitals being shut down because of this issue?
Mm-hmm. Yeah.
Wow.
I don't know the prevalence because it's biased, right? Because we are in the industry. So like, I don't want to, this is not a scare tactic by any means, but for sure, like I've heard of it, specifically hospitals. Yeah. None of ours, like we're actually kind of waiting to see when we're going to get audited. Some of our hospitals have been audited by consultants and they have passed with flying colors, which is like really nice to hear. So that's kind of nice.
Nice. I've got another question for you. So we
Yeah.
kind of talked about the struggles and the challenges, but it's also always nice to look back on the last 10 months. So we've seen that you've grown exponentially, which I can relate to. I know what that's like. It's definitely exciting but challenging at the same time. But like, what's happened, in the last 10 months? Where's your team gone? Like from when you were on the
Yeah.
podcast, it was you and Greg, and I think maybe a handful of other people who works at VetSnap nowadays, who makes up the team. And what are some of the other wins that you've had over the last 10 months?
Yeah, for sure. So we've really scaled up our customer success team. So like when we started 10 months ago, it was really just myself doing customer success with the hospitals. At that time, it made sense, right? Because I was aligned with the product, with our CTO, Steven, and it made sense to kind of hear it directly from the hospitals and get that feedback. Since then, we've hired, we have 9 licensed veterinary technicians and 1 DVM actually working for us in a variety of capacities. And I'll just hit that up there. Like whenever I speak with other friends of mine who are doing startups in our industry, I would just tell them, like, recommend them. Like, please, like the best advice I can give you is once you start scaling up, go out and find these folks who are looking for a transition, who have reached a point in their career where like, they just don't want to lift that, like Rottweiler on the table anymore, but they're like super seasoned. They have a lot of experience. And these are the folks that are working for us. They're making our company, Shawn. I'll just say that. Like where we are today, we could not have been without all the technicians, all on the DVM, all of these folks from our industry working for us. I mean, like they are super smart. And here's why. They're super smart and they know how to work as a team. Because I asked that, like, hey, why are you guys able to kind of just get around solving all the problems that we have? I'm not solving all the problems anymore. A lot of my responsibilities I've given away to other people. I'm constantly trying to work my way out of a job. They're taking it over. And like that's like the best kind of team profile you can have is like technicians. Because guess what? When they were in the hospital, you had multiple technicians working together to save an animal that was about to die. That's the kind of teamwork that we have. Obviously, no one's dying in our scenario, but like that's the kind of teamwork, the mentality we have when we hire these folks, and really they make us, right? So, and the other thing is like we've really scaled up on engineering. Maybe a little bit more technical, but we do a lot of regression testing, obviously, because it's very important for us. So we've scaled up on our engineering team. Our key resources, like we're able to source engineers really fast, very talented, and also like relatively speaking very affordable. So that's also kind of like made us and allowed us to really build our product up.
And very not from United States, I assume.
They are not from some are from the United States. So we have like about 1/3 of our engineering team is in the United States, and then 2/3 not in the United States, and that's probably the case for a lot of software startups.
Oh yeah, absolutely. I mean, that's how we build it. That's how you should be building it because there's not enough talent. And I so agree with the talent in our domain. There's so many people leaving the industry, but they love the industry and they want to continue being in it. They just can't lift those Rottweilers anymore. And our teletriage is an incredible opportunity where we hire people and basically, it's people that have all the knowledge but don't have the capacity or capability anymore to be in the hospital physically. So there's so many pivots. Well, I'm in the industry, but I can't do what I used to do. So I absolutely agree on that. Yang, what is exciting? What is exciting in the next 3-6 months? What are you looking forward to? What are the goals? What are the dreams? What are you trying to achieve in the next half a year to a year?
Yeah, I think maybe to summarize into 3 things, we're really still we're early on in the process of educating and providing awareness around controlled substance management for our industry. Because I think not everybody knows what's available out there. Like us, when we ask people about, when we show them our product, they're like, my gosh, I didn't even know that we could do this. And I just want to let people know, and maybe through this podcast, it is very much possible to save a ton of time and improve compliance. And that's just a constant struggle, a constant fight. There's tens of thousands of hospitals out there. Not everyone will know about us and what's possible there. 2 is we're constantly releasing new products out into the market. I'll just say that this is a teaser. There's a couple pretty key products we're releasing for VMX and WVC. That's going to continue to drive the ability to help with staying compliant and also what to do when an auditor actually shows up at your door. Like we're releasing some products there. Finally, it's just like working to also get more inroads with the consolidators, with the multi-site operators, because I think there is like an even bigger win, right? Because they're looking at it not just from the perspective of a single hospital. You know, right now they might be thinking it's the registered DVM at the hospital that's really responsible for controlled drug logging. But in reality, you know, like if you get audited at one of your locations and the auditor finds out you're part of a multi-site, and then they find out you don't have like a game plan with controlled substance management, you can see where I'm going with this. So we're trying to like just build that awareness with multi-site operators as well. And then finally, we're getting into the non-veterinary space, and that's also fascinating. I mean, like there, I'm constantly learning new opportunities where, again, a bunch of people use paper logs because there's not an affordable solution out there. It's either that or you buy a giant vending machine. And there's a lot of people. It's a lot easier not selling a giant vending machine to folks, right? It's a lot easier to address the 95% of the population than it is to address the 5% that needs that very complicated, you know, piece of machinery to track everything.
I always thought that the giant vending machine is overkill. I always thought there was a software solution to it. So kudos to you. I think we ran out of time as usual. Yang, this is a pleasure to have you on the podcast again. I'm very excited to hear your success. Definitely want to actually learn more about the product itself for our hospitals. So I'm looking forward to seeing you grow and doing this.
Awesome. Thank you.
And so we like to wrap up the same way every time, even though you're a repeat guest. So I got a couple questions for you. A book, YouTube, TED Talk, something that you found inspiring.
The book I'm still trying to finish up is Principles by Ray Dalio, founder of Bridgewater. So I think the main takeaway there is if you want to figure out how to build your business, it's going to involve people. And you're not going to be the smartest person in the room always. And that's just what, like that book just really inspired me to try to challenge myself and everybody else as we're building our company, which is extremely critical for startup, right? You're constantly adapting. So that's the book I would recommend, Principles by Ray Dalio. Highly recommend it, actually.
Is that the guy who was recording all the conversations in his company?
Yeah, there's certain parts that are a little bit extreme and other parts are... The one takeaway I'll say is I always start my meetings now telling people like, hey, just think about whether or not they're in a normal meeting, you have two relationships, a student teacher or a peer-peer. And the biggest mistakes I think a lot of companies make is someone that's like in senior management go into a meeting and they think they're the teacher in a student teacher relationship, when in reality it's flipped. And they just and everybody just assumes because you're more senior, you're like, you know better of everything, right? So that really helps me kind of put things into perspective, whether you're having a debate or this is actually a teaching moment. And I'm not always the teacher. In fact, I'm seldom the teacher these days. And I always remind folks like, hey, I'm not. I'm just giving you advice.
That's awesome. And the last question that we ask is there anybody in the industry that you would recommend inviting on the show?
Yeah. So Dean, he's the founder and CEO of VetVet. It's a up and coming. I don't want to say it's up and coming. I think he scaled a lot. It's a client engagement platform. And I think it's fascinating because it's almost like a mirror image of us when we were early on at VetSnap, just trying to figure out how to kill friction, how to do things better.
Thank you so much for listening to the Veterinary Innovation Podcast. If you want to hear about our new episodes, please follow us on any social media channel. Also, you can check out our website at veterinarynnovationpodcast.com. See you next week.